It's important to note that drug testing isn't mandatory to be able to target substance use in MST, and it isn't right for every family. So a collaborative effort between the therapist, the supervisor, and the consultant is recommended to be sure that if we're going to implement objective measurement, that it's a good fit for the family. Now let's take a look at other benefits to the objective monitoring. First of all, we know that youth report is often unreliable. The verification that comes from objective monitoring is definitely going to benefit us when thinking about the behavior contract that we want to have in place, as we are going to implement a reward when we know the child has abstained as a way to offset the reinforcement of the drug use itself. And when we are more confident that abstinence has occurred, we can also be more confident that the behavior contract is going to be effective at continuing to shape the youth's behavior towards abstinence. Objective monitoring and clean urine screens has been shown to increase the positive affective bond between parents and children. And teens often report that a positive affective bond with their parents, what their parents think of them, is a main reason they stay away from drug use. So with the drug testing protocol, it's important that the therapist introduces it to both the caregiver and the youth and provides the rationale for testing. This can be used as a means to establish a baseline and or provide evidence a problem exists. And it should be done routinely, only when structured rewards and consequences are tied to the results. So things that we want to think about are, before we actually put into practice this objective monitoring, we want to work closely with the caregiver around the behavior plan. We want to have the rewards and consequences identified, and we want the caregiver to even role play and practice and be as prepared as possible to implement the reward and or the consequence as needed. The one time when we would consider not having a punishment in place would be when we're getting that baseline, that initial test. A lot of times we're using that strictly as a baseline, and we're doing it prior to putting the behavior contract into place. Another thing to think about when structuring the behavior contract is that some caregivers find that having a small reward built in to the behavior plan for every time a youth willingly consents to a UA can help ensure less refusal and less power struggle just to administer the UA. And so that's an option as well. Therapist and caregiver jointly will develop the plan for the frequency of testing, develop those consequences for youth refusal or inability to provide a urine, and therapists will help the caregivers practice until the caregiver feels prepared to use the tests. So this is where we do our barrier predicting too. There are a lot of tricks kids use to avoid giving a urine when they know they're going to be dirty. And so this is where we will systematically work with the caregiver to identify all of the typical responses youth have to avoid and make sure that the caregivers are prepared with a response to any of those possible excuses. Like, I don't have to go, or no, I want to wear this really big heavy jacket into the bathroom, where kids have a tendency to carry other person's urine with them. The other thing to keep in mind is we want to make sure that the caregiver knows that within the structure of the objective testing, there should still be a random component to it. So the testing might occur once a week, but it's not going to occur every Monday at 3:15. And it can be really beneficial when it's that unexpected that it also be done within 24 hours of a high-risk period. So if we do our sequencing with the kid and we find out that the typical time of use is after school between 2:30 and 4, then as the parent plans to randomly test at some point that week, they're planning on doing that as close to that 4 o'clock hour as possible. And that ensures that we're going to get the best chance of picking up on use if it did occur.